everybody. This is Shalai Chopra again. I'm here with Dr. Jim Logan for the Lumina Leadership Insights series. Welcome. So excited to have this conversation with you, Jim, and learning more about telemedicine, which is certainly one of your passions and where you have such great and vast operational experience as well, working with NASA, working with healthcare organizations across the country, as well as physician leaders. So thank you for taking the time to visit with us.
Thank you. It's a great opportunity.
When we talked last, you were talking about how telemedicine as a technology has evolved over the decades. As the technology has evolved and matured, so has the acceptability across the spectrum. With consumers, with patients, I certainly am in favor of that, but I understand we had to jump through some hoops in developing the credibility, in ironing out the kinks from process perspective, from legal, from payer perspective, but then also acceptance of that from a provider perspective as well. This is definitely a new way of having contact with the patient and providing care, which is not face-to-face, which does not have human touch to it. So in your experience, as you worked with the evolution of telemedicine over the decades, what is your take on the evolving role of providers in this paradigm shift of telemedicine?
It's an excellent question because the big problem in telemedicine was getting buy-in from the providers. The patients loved it. The healthcare system loved it. The providers really weren't sure. And in fact, initially, the older the provider, the more antagonistic they were to the whole concept. I can't tell you how many times what I would call senior providers, the guys and gals that were maybe over 50, that were still in medicine, their attitude about telemedicine and computers in general was, I don't want to learn that, I don't want to deal with it, I want to practice medicine for the next 5, 7 years, cash out, and let the younger generation worry with all this technology. Over time, as you got a new cohort of physician, younger physician, that had grown up with computers, and they were much more comfortable with it. So not only were they more accepting of it, they became kind of technology drivers. But the one thing you had to learn to do was to not make the technology another obstacle for the provider to get to the end of the day. So you had to integrate the technology into the world of the provider so that it was, to the degree it could be, it needed to be seamless.
Absolutely.
If it was another barrier, immediately you would have resistance.
Absolutely.
But the patients always loved it.
I certainly do.
I did a lot of work for the military. The military has a whole Pacific theater of medical operations. There's only one quaternary hospital, and that's Tripler Army Medical Center in Honolulu. So they use telemedicine in order to pre-qualify a patient that needed access to a specialist. There were no cardiologists in Guam. There were only 2 dermatologists in Guam. And so we had American servicemen and women down there that needed this kind of expertise. So they used the technology to pre-qualify a patient in order to come visit the dermatologist. So you had to do kind of a telemedicine consult first in order to weed out those conditions that could be adequately treated at the remote side from the patients that really needed to come and see the specialist. The specialists ended up liking that because their day now was full of people that really needed to see the specialist.
It become more effective.
Yes.
So you've talked about, a couple of good points you've raised in our talk here. Make the technology accessible at the point of need.
At the point of care.
Be mindful and intentional of what services you are providing through this technology. In other words, make sure you're meeting the need, the real need versus the perceived need. Pre-qualify patients, so you're really, tunneling the right patients through this tunnel and creating value for the specialist, for the provider, as well as a patient. Now, I'm a data nerd, so I have got to get to the data aspect of it. At the end of the day, as we leverage technology as an enabler to create access to care, how do you measure the value you've created from this. And, I'm looking at the trends where the industry is going. Why stop just at using telemedicine as a conduit to provide access? How can we maybe tap into artificial intelligence, AI, to get further specific on the type of care and the value of care we're providing?
The whole idea of layering artificial intelligence on top of the medical paradigm, and especially over the top of telemedicine, that has a lot of advantages. Anytime you deal with a cognitive specialty like nephrology, there are tests, but they aren't very sophisticated. It's mostly a cognitive specialty. Or anything that involves a digital image like derm, or radiology, or any of the digital imaging. Now we can begin to use artificial technology to look at those images and make one decision. Is this normal or is this abnormal? And you set the bar pretty high for normal, especially initially. But if the system says this is normal, then the specialist doesn't have to see it. Okay, so you automatically funnel off a bunch of normal readings. And of course, there are false positives and false negatives.
Absolutely.
You have to set the system up to catch those in some way. But then you are able to leverage the specialist's time much more efficiently. And it's, quite frankly, much more fun for them.
It is, and I kind of come back to what most healthcare systems right now are struggling with is providing more effective care, increasing better outcomes at lower cost.
At lower cost.
Lower cost. So this definitely is one of the tools that we can use to meet those two goals. I know we're running out of time. I much appreciate it. There's more to come with Dr. Jim Logan. In April, we're going to host a webinar where we talk about how to leverage data, how to leverage the technology that telemedicine brings to the table, how to pair this technology with perhaps other technologies that can be wrapped around telemedicine to achieve optimal return on investment through telemedicine programs. And especially with the new CMS ruling that came out in December, there is now an increased opportunity, increased reimbursement for telemedicine services. So there is certainly a great deal of interest across healthcare organizations on how to optimize their use of telemedicine programs. So be on lookout for our upcoming webinar where we will dive in a bit deeper into the whole topic of telemedicine. And Dr. Logan, thank you so much. And I look forward to our continued conversations on this topic.
Thank you.
Have a great day.